introduced to polio. Thank you. As Rotarians and interactors, we've been introduced to polio as one of the causes since our induction, and some of us may not always understand what this is about. How did it start? Why polio? Why, if we're so close to eradication, do we need to still be raising all this money and all this awareness? Well, in this session, I hope to answer just a few of those questions and clear up the blurriness about Rotary and polio. So now I would like to invite our esteemed President Rishi Ram Logan, to bring a few words of greeting.
Hi, good evening, everyone. And thank you very much for that introduction, Director Lindsay. And also welcome to all our interactors and all students who have taken the time out this evening to participate in this exercise of World Polio Day. You know, as I begin, I want to record, that all our members, or I wanted to go on record that all our members in our club, even if they are not present here virtually today, they have all contributed in their own way over the years to end polio. And it's very important that we recognize the work of our Rotarians, our founding members, our charter members before us, that they were here long before we came to this club to actually participate in those polio eradication efforts. And it's a thought that I have always had in my mind, that before I would have gotten involved in end polio or in the actual polio, the work of Rotary, there were those before us who would have taken a very serious stance to end polio throughout the world. And before I even begin my speech, I really want to say thank you to all those people, not only in our club, but those in other clubs as well, and Rotary throughout the world, who would have taken part in the eradication of polio for more than 35 years. Because you see, Rotary has been working to eradicate polio for more than 35 years. The Pan American Health Organization only today in the Trinidad Express explained that for 30 years, this region, this part of the world has been polio free, which means the countries that are supported by the Pan American Health Organization. And our goal of ridding the world of this disease is even closer than ever. As a founding partner of the Global Polio Eradication Initiative, we've reduced polio cases by 99.9% since our first project to vaccinate children in the Philippines in 1979. Rotary members have contributed more than 2.1 billion and countless volunteer hours to protect nearly 3 billion children in 122 countries from this paralyzing disease. Rotary's advocacy efforts have played a role in decisions by governments to contribute more than $10 billion to this effort. Today, polio remains endemic only in Afghanistan and Pakistan, but it's crucial to continue working to keep their countries, other countries, polio free. If all eradication efforts stop today, within 10 years, polio could paralyze as many as 200,000 children each year. When we were growing up, we were taught of poliomyelitis being a deadly disease that affected children via their legs, and that it would be a problem of one leg being affected. But later on, we would learn that as an advocate for polio, it paralyzes children not just in the legs, but throughout the body. It can also lead to death in some cases. And it's very important that we as Rotarians take action for World Polio Day by promoting the importance of polio eradication, raising funds, and planning events such as this one. Let's engage our communities in the fight against polio, because as long as polio exists anywhere, it remains a threat everywhere. In this year of a global pandemic, it is important that we all note that after polio comes COVID, and Rotary has already taken COVID to a different level. We have already taken the COVID fight in some nations head on. In some countries where there exists no toolkit, there exists no framework for the fight against COVID-19, Rotary has been there to automatically take up the mantle and crack the whip on the back of COVID-19. It is very important to note that we have the people, we have the resources, we have the expertise, and most importantly, by taking part in the vaccinations against polio, we were already vaccination kings and queens in what we did. This is what we do. This is who we are. So when COVID-19 showed its face to the world, we were ready for the fight because we knew that at some point in time, this kind of disease was going to affect the rest of the world. It is also important to note that the Bill Gates, through the Bill and Melinda Gates Foundation, has been working with Rotary since 2007 to help fund the effort to eradicate polio. In an effort to eradicate polio worldwide, led by the World Health Organization, UNICEF, and the Rotary Foundation, the Bill Gates Foundation, in June 12 at the RI convention in 2007, said, and I quote, "Rotary laid the foundation with its unwavering sense of purpose and its belief that anything is possible if you put your mind and body to it." Bill Gates noted that more than 16 million people would otherwise have been paralyzed by polio are walking today. As members of Rotary, we are proud to support this program. We have raised over $45,000 US so far in contributing to the Rotary Polio International Fund. And via the Gates Foundation would have matched that foundation, that value as well, and even tripled in some cases the donations to polio. So it's very important that today we recognize that this World Polio Day message, this World Polio Day observance, although virtual, sends a strong message to the rest of the world that we are here to eradicate one of the most crippling diseases ever. That we are here to ensure that as Rotary continues for the next 100 years or the next 200 years in the life of Rotary, that we are ready to take on any other diseases that face the world. We were there in the beginning, and we're going to be there at the end to ensure that polio remains just where it is, outside of most countries. And I do hope that in the next year or two, we can fully eradicate polio within Afghanistan and Pakistan. I say thank you to the interactors, and thank you to all those today who would have put together this program and this presentation that we're going to look at in a short file. And special thanks to Director Lindsay for working with the students and the teams that we all would have worked with. So thank you all, and thanks Lindsay, and over to you.
Thank you, Prez. So as I said before, this World Polio Day awareness event is a joint effort between our club, which is the Rotary Club of Princestown, and our Interact Club of St. Stephen's College. So now I want to introduce you to the president of the Interact Club of St. Stephen's College, and this is Anushri Haricharan, and she will be doing a presentation together with other members of her club. Thank you.
Good night, everyone. My name is Anushri Haricharan, and I'm the current president of the St. Stephen's College Interact Club. I am here with a few other members of our club tonight to do a presentation on the eradication of polio and Rotary. So firstly, polio's history reference to Rotary. Polio or poliomyelitis is a paralyzing and potentially deadly infectious disease that most commonly affects children under the age of 5. The virus is spread from person to person, typically through contaminated water, and then affects the nervous system. The eradication of polio is one of the longest standing and most significant efforts of the Rotary community. In the fighting against polio and started efforts in 1978 with a very ambitious goal to reach a polio-free world. I would now pass on to continue.
How it all started. During a speech to Rotary leaders in February 1985, Then Rotary President Dr. Carlos Canseco announced the commitment to control polio worldwide. Since that day, Rotary's dedication to the global eradication of polio has remained constant. Though the Polio Plus program started in 1985, Rotary began the fight against polio much earlier. In 1979, Rotary members began a multi-year program that immunized more than 6 million children in the Philippines against polio. During his 1985 speech, Canseco reminded Rotary members and the world, and I quote, "Rotary cannot hope to rid the world of polio on its own. But if we step up our efforts and add them to those of the World Health Organization's expanded program on immunization, UNICEF, and other agencies over the next 2 decades, we can be truly effective in accomplishing this mighty task." End of quote.
Passing on to Andrea.
In the 1979 agreement between Rotary Internationals and the Philippine Ministry of Health for a joint multi-year effort to immunize children against polio, representatives from Rotary International and the government of the Philippines signed the agreement that started Rotary International's first polio project. Rotary's main goal towards polio. Rotary has been working to eradicate polio for more than 35 years now. Their global freeing the world of this disease is closer than ever. As the founding partner of the Global Polio Eradication Initiative, they've reduced cases by 99.9% since their first project to vaccinate children in the Philippines in 1979. It is crucial to continue working to keep other countries polio-free, because if all eradication efforts stop today, within 10 years, polio could paralyze as many as 200,000 children each year.
And finally, Shamal to continue.
World Polio Day 2021. World Polio Day is celebrated every year on 24th October. It was initiated by Rotary International over a decade ago to commemorate the birth of Jonas Salk, who developed a vaccine against poliomyelitis. 2021 theme, One Day, One Focus, Ending Polio, delivering on our promise of a polio-free world. Thank you for watching. Hope you enjoyed the presentation and you were educated on polio.
Thank you very much to the Interact Club for that very concise but informative presentation. I have a presentation that I would like to do now, which just delves a little bit deeper into Rotary and polio. So as I said before, when I started, there are a few questions that people may have about why Rotary and polio. So these presentations would help to understand these questions and get answers to these questions. Okay, can you see my screen? Anybody say yes?
Yes, Cecilia.
Okay, thank you.
Yes, we're seeing it fine.
Thank you. So the title of my presentation is End Polio Now, and it is celebrated on October 24th every year. Oh. Slide number 2. Okay, So World Polio Day, it provides an opportunity to highlight global efforts towards a polio-free world and honor the tireless contributions of those on the front lines in the fight to eradicate polio from every corner of the globe. The Global Polio Eradication Initiative is a public-private partnership led by national governments with 6 partners: the World Health Organization, Rotary International, the CDC, which is the US Centers for Disease Control and Prevention, the United Nations Children's Fund, which is UNICEF, Bill and Melinda Gates Foundation, and Gavi, which is the Vaccine Alliance. Its goal is to eradicate polio worldwide and end the suffering from this devastating disease. So, sorry, let me just make sure I'm going in order. Sorry. So as was stated in the previous presentation, poliomyelitis is a highly infectious disease that most commonly affects children under the age of 5. So in this presentation, I will just give the general timeline of polio itself and when Rotary became involved in the fight against polio. So in 1905, a Swedish physician, Wickman, he suggested that polio is a contagious disease and it can be spread from person to person. And he also recognized that polio could be present in people who show no symptoms, similar to COVID. In 1908 now, the 2 physicians this time in Vienna, Landsteiner and Popper, they discovered that polio is caused by a virus. So before this, they just knew it was contagious. But in 1908, they figured out that it was spread by a virus. In 1916, there was a major polio outbreak in New York City and the wider United States. And this it took the lives of more than 6,000 people and paralyzed thousands more. In 1929, Prez said previously that growing up, he knew polio to be a disease that affected one limb in children. And then he realized that it affected the entire body. So there was this Dr. Philip Drinker and the Harvard University's another doctor. They invented an artificial respirator for patients suffering from paralytic polio, and this was called the iron lung. In 1955, a vaccine was developed, and as the interactor said before, by Dr. Jonas Salk, and he declared that it was safe and effective. In 1960, the polio vaccine was licensed by the US government. Okay, next slide. All right, so I know this slide is a little bit busy, but this is where Rotary came in the fight against polio. So in 1979, Rotary International began its fight against polio with a multi-year project to immunize 6 million children in the Philippines. So as we see there, it was started in the Philippines. In 1985, Rotary International launched Polio Plus, which was the first and largest internationally coordinated private sector support of a public health initiative with an initial fundraising target of $120 million. In 1988, Rotary International and the World Health Organization launched what came to be the Global Polio Eradication Initiative, which is still in being and now consists of 6 organizations. There are an estimated 350,000 cases of polio in 125 countries at that time in 1988. The National Commission for the Certification of Poliomyelitis Eradication announces in 1994 that polio has been eliminated from the Americas. So that was their first win In 1995, health workers and volunteers immunized 165 million children in China and India in 1 week. Rotary launches the Polio Plus Partners Program, and this program enabled Rotary members in polio-free countries to provide support to fellow members in polio-affected countries for polio eradication activities. In the year 2000, a record 550 million children, that's almost 10% of the world's population at that time, received the oral polio vaccine. The Western Pacific region, spanning from Australia to China, was declared polio-free in 2000. In 2003, the Rotary Foundation raised $119 million in a 12-month campaign. Rotary's total contribution to polio eradication at this time exceeded $500 million US dollars. And there were only 6 countries which remained endemic of polio at that time, namely Afghanistan, Egypt, India, Nigeria, and Pakistan. That was 2003. In 2006, 2 countries got knocked off from this list, and there were only 4 countries remaining endemic with polio. Endemic means that there's this disease that is confined to a particular area. And these 4 countries were Afghanistan, India, Nigeria, and Pakistan. 2009, Rotary's overall contribution to eradication effort neared $800 million at that time. And in January, the Bill and Melinda Gates Foundation pledged $355 million, and they issued a Rotary Challenge, grant of $200 million. This announcement resulted in that time of a $555 million pump into the support of the Global Polio Eradication Initiative. In 2011, Rotary welcomed numerous celebrities and major public figures into the polio awareness campaign, and they called it the This Close to Ending Polio program. Program ambassadors included Nobel Peace Prize winners like Desmond Tutu, co-founder of the Bill and Melinda Gates Foundation, Bill Gates, Grammy Award-winning singers like Ziggy Marley, and environmentalists. In 2014, India goes 3 full years without a new case caused by the wild poliovirus, and the World Health Organization certifies the Southeast Asia region as polio-free. Polio cases are down now over 99% since 1988. In 2019, Nigeria now goes 3 full years without a new case caused by the wild poliovirus. And in 2020, I remember celebrating this one because I was in Rotary at that time. The World Health Organization certified the African region wild polio-free. And in 2021, only Afghanistan and Pakistan remain polio endemic. So why do we continue the fight? Why do we need more money? Why more funds? To end polio, we must stop transmission of wild poliovirus in the 2 countries that continue to report cases, which are Afghanistan and Pakistan, as said before. Why does 0 matter? Polio cases have been reduced by 99.9% worldwide since 1988, but it is critical for us to continue our efforts to eradicate the disease completely and for good. There is a risk of resurgence of the polio. If polio is not fully eradicated, we could see a global resurgence of the disease with as many as 200,000 new cases each year over the next 10 years, all over the world. So the challenge is for worldwide eradication. As we get closer to ending polio, we need to increase disease detection, also known as surveillance. We need to ensure that the virus is truly gone from every corner of the world. Given that only 1 in 200 cases of polio results in paralysis, we rely on extensive programs for surveillance and lab networks to tell us where polio does exist. So understanding eradication, as you can see in this little, I don't know, I hope you can see it properly, but understanding eradication means that you immunize everybody, then you have a case count of 0. So you have no more cases in that particular region. But only after 3 years of having no new cases in a particular area is it considered eliminated from that area. So we have a few years to go still, counting on Afghanistan and Pakistan to become polio free. So even after there are no new cases in these regions, we still have to vaccinate everybody and make sure that for the next 3 years, no new cases crop up. So that's where our money goes. So the solution would be to finish the fight. Together with our partners, governments, community leaders, health workers, and volunteers, we must stay vigilant. Until we eradicate the disease, we must continue to immunize every single child against polio. What does our money buy? So for example, in January of 2019, Rotary gave nearly $50 million in grants to our partners, WHO and UNICEF, for polio eradication activities. The money will pay for technical expertise and social mobilization in 11 countries across Africa and Asia. Some examples of how the money was used. So for example, in Pakistan, 111,817 vaccinators delivered the vaccine. In Afghanistan, they are very big on polio awareness in these regions because it's still there. So they painted 12 murals and released a mobile app to raise awareness in high-risk areas. In Iraq, 30,781 markers to mark the fingers of children. I don't know if you would have seen pictures of it. They mark the children, the children's fingers, the pinky fingers, who were vaccinated. And again, in Afghanistan, they distributed 13 million caps, shirts, and aprons to vaccinators and volunteers. So that's where our money goes every time we donate to polio. Oh no. Oh, okay, sorry. So this is my nice map here of where we started. So in 1988, well, we picked up polio in 1979, but from 1988, as you could see on this map, the darker areas are the areas that were endemic to polio. And now in 2020, we are down to 2 countries. So I would say that this is fantastic progress. So I thank you for listening. And please let me know if you have any questions or comments. Nobody has a question? You don't want to know where you can get this polio pin? Yes, Uncle Jim.
We can't see it from so far.
Jim needs to unmute.
You need to unmute your mic.
Right, okay, you hearing me?
Yes.
All right. One of the reasons that why we need more money for polio is that this is a continued process. It doesn't end when we finish now, because you have children being born, and all the children that are newly born within 5 years, we need to continue this drive. So every 3 years, polio is continuing We can't stop because there are new births throughout the world. And this is one of the reasons why we need a continuing fund for polio.
Yes, that's true until it's completely eradicated and they are sufficiently satisfied that there's no more polio, then we could stop and move on to something else. Nobody want to know how to get a t-shirt?
So see, I don't have any questions, but I do have a comment on the presentation itself, both by the interactors and by Director Lindsay. I think it was very nice that they would have put some timelines to give everyone a good historical overview of how we got to this stage with polio, and how we actually see a nice chronology of events. It was very well thought out in that, you know, both presentations, if a layman were to read it for the first time, he could actually tell that this is where the history is going. Because even for me, in my reading, some of that stuff I didn't know. So it's good that, you know, we have it in this format. I would like to see the PowerPoint presentation shared, and maybe we could even put some of the slides up on our Facebook page and our website, so that some of that information would remain there, you know, permanently at some point in time.
Yes, definitely, we will do that. Okay, so if nobody has any more questions, I know. Oh, sorry, Dr. Gobin. Yes, lovely input.
Hi guys, excellent presentation, Lindsay. I'd just like to add that before a country becomes polio free, they must be declared free of the wild polio virus for 3 years.
Yeah.
So far, up to this point, there has been only one case of the wild polio virus in Afghanistan and one in Pakistan. So we are getting there. We're getting closer. So congratulations to you and the Interact team. Good job.
Thank you. Thanks, Dr. Gobin. Anybody else?
I just want to make a comment. I don't think the younger generation in our society knows or really understand what polio is, because there are very few cases amongst us. And my first encounter with polio was in 1955 at Princeton Muslim School. There was a child who came and we saw him with all his casts in his leg and he was walking limp. And we asked the teacher then, I was in standard 2, and the teacher himself could not explain to us what it was. He only said to us it was a disease called polio, and that's why his leg is like that. But polio has been around, I mean, in my time, but there were not very many cases. So that people here, the younger generation, really does not have a first-hand knowledge or look of what polio does to someone.
Yes, that's true, because I don't think I've ever encountered anyone who
exactly
has polio or had polio. Well, Rotary was working long before me, yeah? Long before I was born.
Yes. Past President Zobida has her hand up right now. I believe she has something to say. Zobida, you want to take off your mute?
Yeah, unmute your mic.
Okay, good night, fellow Rotarians. Congratulations, my dear Lindsay. You have done an excellent job. Now, everybody knows about polio. We have some people who had polio. Jim, former Minister of Health. What's his name again?
Manuel Hussein.
Manuel Hussein.
Yes, and somebody else.
David Rodda.
Oh, David Rodda, right. So I am happy that the children did this project so that they now in turn will educate people in their schools about polio. So once again, congratulations, job well done.
Thank you. Thank you for your comment.
Right. So if
couple of questions from me, please.
Sure.
Sorry.
Please, only easy questions. I can only answer easy questions.
I'll try and keep it easy. Well, I have two questions, right? Well, first and foremost, well done, Director Lindsay and the interactors. Great presentation. My two questions are, one, what's the difference between I keep hearing wild polio, and is the wild polio a different kind of polio? Is that, and I don't know if anybody knows when we would have had the last case of polio in Trinidad. I don't know.
Excellent questions, Michael. The first one, there are 3 strains of polio: wild poliovirus 1, wild poliovirus 2, and wild poliovirus 3. I don't know if there are any tame versions. I'm sorry, but there are 3 strains of the wild poliovirus that are endemic, in the world. And as time went along, we know of the oral polio vaccine, right? That's the one where you put a few drops on the kid's tongue. So the vaccine initially covered all 3 strains, but then the second strain, wild poliovirus 2, was eradicated. And now they changed the oral polio vaccine, and it only covers the first and the third strain. So if you've noticed recently, they've started giving children a first shot of the polio vaccine, which is at 2 months, I believe. They don't get the oral polio at 2 months. They get a shot, a polio vaccine shot, and this one covers all 3 strains. This does not answer a question about wild and tame, but I'm just letting you know about the vaccine. So they get a shot which covers all 3, and then they continue with the oral polio, which has 1 and 3 for the rest of their vaccinations schedule. And as to when was the last case of, I guess you mean when was the last contracted case, because David Rudder is still alive. So I don't know the answer to that question either. Sorry, I will research it and get back to you.
Yes, very good question, Michael. I just want to chip in with one more thing. My wife actually takes care of her uncle. He is 72 years old. He lives alone in Marabella, but she basically takes care of him almost every day by going back and forth to his home. And
That's not old.
He is a polio victim. He does have slight paralysis of the limbs and so on. But at 72 years old, he's able to, at least move around the house, cook his own food and so on. So just to let you all know that, one, it's the virus itself. But the second thing is, I would pay very special contribution to my wife here, a very special, thank you to her for taking care of a polio victim. We do have someone amongst us right now who on a daily basis, morning and evening, takes care of a polio victim on a regular basis. So she has had a childhood experience in taking care of a polio victim from the time she was born. She has known him. But Uncle Doc is a very family favorite. He is healthy. He walks around very well. He gets his stuff done when the day comes. He actually takes care of dogs and he sells Doberman pups and so on. So he's very active. But at the end of the day, it was very difficult because due to polio, he couldn't go to school. You see, he is 72 years old. So when he would have had to start, let's say 67 years ago, he had to start primary school. He couldn't start school because he was actually a polio victim and he was unvaccinated. So the teachers at that time couldn't accept him in school. So he went to school a little bit later and so on. So it's very important that the topic of vaccination and vaccinating children and vaccinating those among us, to the young children who are here, Anushka, Amrika, Anushri, Andrea, Selena, and so on. I'm seeing quite a lot of young people here. My own children are here as well. It's very important that children understand the aspect of vaccination, how important it is, and how it can affect one's life. So I just want to use this moment to say thank you to my wife for what she has done her entire life for a polio victim. Right? So thanks a lot.
Yes, thank you, Nadi, for your work. Okay, anybody else? Any more contributions? I really like that it's so interactive. Okay, so now we will move on. I just want to invite Anushri Haricharan. As I said before, she's the president of the Interact Club of St. Stephen's College. And I just wanted to bring a few words of greeting to us and let us know what has been going on with the Interact Club of St. Stephen's College. As our club members know right now, this is the only club of ours that is active. And they've been doing some really good work. They've been active all through the COVID, and they've been able to have their elections. They have a new board in place. They have new plans for this year. So I really applaud them for their efforts. And I just invite Anushri to just give us a few words. Thank you.
Good night again, everyone. So recently, as Dr. Lindsay said, we had our election. A new board was elected and it's going pretty well. Then we have meetings every Monday at 3:30 p.m. for the entire club, general meeting, where we update them on club events and all of that. We have board meetings once a month and whenever needed in between, like if an event come up and we have to plan before we introduce it to the club, we have our own board meeting and we have our plan in there. For this coming week, we actually have an exciting part, which is where we bring in new members of the club. That will happen tomorrow, actually. So I think we should show our presentation to them and educate them on polio as well. That'll be really nice for tomorrow. I'll talk to board members about that in a few minutes after the meeting. And then for our main event for the ending of this year is our annual Christmas charity drive, which is where we collect donations and we make hampers starting from November, and it will go straight into December for Christmas, when we will deliver the hampers to the Princeton community. So that's our main project for the year. Until next year, we will meet again to discuss new events. Thank you.
Okay, great. Thank you very much.
Excellent work, Anushri.
Thank you.
Got it? I would ask everyone via Zoom to give a Zoom desk thumping to the Interact Club of St. Stephen's College, led by Anushri. Thank you very much.
Yes, thank you for that update, Anushri. Okay, I just have a few other little things to say in my closing remarks. I'm sure everybody wants to know how to donate to the Polio Plus Partners Fund now. Okay, so every year, the Rotary Club of Princestown donates to this very cause. So if you would like to donate, you can go through us and it will be a donation to the cause, and it will reach the Polio Plus Partners Fund. The other thing is you could go onto the website, which would be endpolio.org if you want to donate for yourself. And you just click on the donate now knob and it will guide you through how to donate. So just a few facts about our club itself. Every year we have a signature fundraiser, which is our tea and fashion show. For the past 10 plus years, it's been held at the Hyatt. And the proceeds from this fundraiser are what we use for our polio donation every year. And well, this year we don't have the tea and fashion show in the Hyatt, but we will have a fundraiser to donate towards the Polio Plus Fund. So look out for that. And up to this point, the club, our club, which is the Rotary Club of Princestown, and its members have donated upwards of $45,000 US to the Polio Plus Fund. Okay, so that was just some fun tidbits there. Anybody has any questions? Any comments? Okay, I will now like to invite President-elect Rudranath Miraj to move the vote of thanks. We are right on time. Uncle Jim, take note.
I know.
Thank you, Director Lindsay. Pleasant good night, my fellow Rotarians, our interactors, parents, friends, relatives, especially invited guests. It gives me great pleasure to give the vote of thanks. First, and most importantly, we want to thank God for allowing this opportunity for us to meet like this. Next, we would like to recognize everyone who had a part in planning this event. Our President Rishi for letting us host such an event under his leadership. To our exceptional PR team led by Narisha and the complement of professional and talented committee members, including Justin, Nabil, and others. They truly did a superb job in capturing the audience for this event. To the students of the Interact School of St. Stephen's College, namely Anushri, Andrea, Lara, Haley, and Shamal, we extend our gratitude to you all and your club members for partnering with us on this polio awareness project. We would also like to thank the patron teachers and other staff members of our Interact schools for always aiding and motivating the students and getting the word out there for this event. To you, our wonderful online audience, this could not have been possible without you. Thank you for your time and cooperation in using the virtual background. And thank you for attending to make this event a success. Finally, special thanks to our foundation director, Dr. Lindsay Aziz, who was instrumental in coordinating and sharing this polio event. Thank you all again. Back to you, Madam Chair.
Thank you very much for your gratitude. So that brings us to the end of our online polio awareness event for 2021. It was short, it was sweet, and now we have dinner. So collect it on your way out. That's a joke, please laugh. We could just have a few minutes for fellowship if anybody has anything they want to say. Oh, Michael, I sent you a video in your email. If you could access it, could you kindly play it? So in the meantime,
can everyone please come on camera so we can get a camera shot with everyone here on Zoom, whether you have the background or not. Let's please get one camera shot, and I'll ask more than one person to please take a print screen, just in case my own doesn't pick it up, others will pick it up. For those who are on a PC, okay. Still seeing some people not on camera.
I really had a vision with this virtual background thing.
Put them in set.
I don't see it, Lindsay.
Oh, sorry. Okay, never mind. It's not that important.
Is it online or?
Yeah.
You can put the link in the chat, I'll play it.
That's the thing, I can't get the link. Don't worry,
Oh.
Don't worry, it's okay.
Everybody on camera? I've seen a few people still not on camera yet. Okay. Well, let's see some more people on camera.
Oh, Narisha, you're here twice.
Yeah, I'm seeing Narisha here twice. Okay, at least we have some. We have some on camera.
One for hearing and one for vision.
I'm seeing Darren here on camera here, right? See who else we get on camera, right? Give everybody 1 more minute to come on camera. If not, this is what we have. This is the shot we're gonna take, right?
Just saying, but your kids are disobeying you. They're sitting right there and not listening to you.
Yeah, I realize, right? Yeah, I've seen one. One just came on, right?
Anushka just came on.
And America.
Hi, Amrita.
It's just Ahmed. Where is he?
I haven't seen Ahmed.
I think he was sharing background with somebody.
Oh, okay, okay.
Okay, let's see anybody else. Anybody else going to once, going twice?
I think we get there.
Okay, well, let's go. Screenshot.
Oh, wait. Ahmed
Wait,
coming
wait.
back.
And Anu, stop moving.
Listen too quick now. Will have me posing.
Okay, everybody say cheese.
Rotary.
Say polio.
Polio.
And polio.
And the polio. That's right.
Anybody else getting
And
screenshot?
polio now.
And the polio now.
Okay, right. So we got some screenshots there, guys. Thank you all. Okay. Right,
This was
just-
great. Thank you.
Hold on, give me
all.
1 second. Let me make sure I see these screenshots showing up. Okay, just give me 1 second again. Okay. Yep, we got it. Cool. I just WhatsApp it out.
Okay. Thank you.
Thank you all.
Thanks, Rez.
Right.
Great.
Over to you, Lindsay.
Well, that's it. That's it for me. Thank you all again for coming, for attending our Polio Day awareness event. Yes, and that's it.
Bye-bye.
Bye.
Well done, well done.
Talk to me on the phone, Rishi.
Yeah, Jim, I'll try and call you.
All right.
You guys on Wednesday. Virtual Wednesday.
Oh, is it virtual Wednesday?
So
perhaps?
to all club members, no meeting on Wednesday. Wednesday's meeting is going to be moved to Saturday 30th for
Right.
our Diwali function, and that's why I have to call PP Jim to confirm that we can use home by him, and we'll make sure, right? We'll make sure that that all members are treated to a nice Diwali celebration. Okay, so stay tuned and please spread the word to those who are not here. Right, so adios, everyone.
Bye.
Bye-bye.
Bye.
Happy Diwali.
We'll see you, Dr. Goben.